Hey guys, welcome to my channel. So today we will be talking about acute inflammation. By definition, it is a complex series of events that occur in a vascularized living tissue in response to local injury or tissue damage. Now, why do we need inflammation? See, it is needed in order to eliminate the cause of tissue damage, to repair injured or damaged tissues, and it is an innate defense mechanism of our body. Now, this inflammation is of two types. One is acute, the other one is chronic. Now, acute inflammation may go up to few minutes to few days, but chronic inflammation, it can take up to years. Years in order to manifest its symptoms, right? And acute inflammation, we have the major cell that we are going to deal with is neutrophil. Whereas in chronic inflammation, we have lymphocytes and macrophages. Right. Now, what are the causes of inflammation mainly? The first cause can be a physical agent. So, in physical agent, we can talk about heat, we can talk about cold. So, heat may cause burns, whereas cold may cause frostbites, right? The second thing can be a chemical agent. So, any kind of chemical irritant may cause any kind of inflammation. And the third one is your bacteria and virus. So, any bacterial or a viral attack may cause any kind of inflammation. Now, a very important question usually asked in exam papers and viva is cardinal signs of inflammation. Right? So, there are 5 cardinal signs of inflammation. See, we have pain, which is called as dolor. We have heat, that is called as calor. Redness, that is rubor. Swelling is your tumor. And loss of function is called as functio-laser. Right? So these are the 5 cardinal signs of inflammation that we need to remember. Okay. Next up is the acute inflammation has vascular events and cellular events. Right? So in vascular events, we will be dealing about hemodynamic changes and vascular permeability. And then cellular events, we have exudation of leukocytes and phagocytosis. So this is, here we will be talking about vascular events mainly. Now what happens is, if there is any kind of cut or something, so there will be the immediate effect that you will be seeing is oozing out of the blood. So there has to be an immediate vasoconstriction followed by a persistent vasodilatation. So vasoconstriction is needed in order to stop that oozing out of the blood. But once that is achieved, there will be a persistent vasodilatation. Now, because of that vasodilatation, there will be stasis in the blood flow. So, there will be an increased blood volume in that respective area. And that is going to cause redness and warmth around that site of inflammation. Now, after that, what is going to happen is there will be transudation of fluid in the extracellular spaces. Right, and that is going to cause swelling. So any kind of edema or swelling that we see around the area that is slightly being cut is because of the transudation of fluid in that area. Okay, now next is that this blood vessel has certain endothelial cells arranged, right, and these are compactly packed. But what happens is in such cases there will be contraction of these endothelial cells, and a space will be created here. This space is responsible for increasing permeability of the vascular tissues. Right? So these were the vascular events. Now let's talk about cellular events. In cellular events, the events marked are margination, rolling, adhesion, diabetes, chemotaxis, and phagocytosis. Right. So what happens is, usually there will be a normal axial flow of the blood. Everything will be normal. But once there is any inflammation that is observed, there will be decreased rate of blood flow. So the immediate thing that we will see is there will be stasis in the blood flow. That is decrease in the rate of the blood flow. Right. After that, we are going to see that these leukocytes, that is WBCs, or we call it as leukocytes, they are going to arrange itself around the periphery. See here, she starts arranging around periphery. Okay. So now this is the first event that is called as margination. So arrangement of leukocytes around the periphery is margination, right? Okay. Now after margination, what happens is, because of a specific protein that is called as L-selectin, it will cause rolling of this leukocyte on this endothelial cells or endothelium, right? After rolling, the second step comes as adherence or adhesion. Here the protein that is involved is integrins. Because of integrins, there will be adhesion of this leukocyte to the endothelium cells. Okay. And after that, because of the contraction of this endothelial cell, see there is a contraction, so there's a space created, right? There will be, this leukocyte is going to throw its cytoplasmic pseudopores through from this blood vessel, and it is going to this process is basically called as diapedesis. I'll write it down here. And through this diapedesis, this leukocyte is going to transmigrate or emigrate from the blood vessel. So it is a very important event marked in the cellular events. Right. Now, I will just explain it briefly here. Later on, I'll tell you what exactly is chemotaxis and phagocytosis. See, after this leukocyte comes out from the blood vessel, it is going to go towards the side of the inflammation. Now, this process of migration of leukocytes from blood vessel to the site of inflammation is called as chemotaxis. Right. How does this occur? I will tell you later. Right. After that, we have a step called phagocytosis. We all know what is phagocytosis: engulfment of any bacteria. Right. And then this macrophage is going to self-destruct itself through a process called apoptosis. So this is mainly rolling, adhesion, transmigration, or diapedesis, chemotaxis, and phagocytosis. Now, what happens in chemotaxis? See, there are certain chemotactic factors. In chemotactic factors, we have certain chemokines, like histamines. We may have certain platelet-derived factors, right? We may have leukotrienes. So what happens is, this leukocyte, when it comes out from the blood vessel, see, if when it comes out from the blood vessel, it does not know where exactly the site of inflammation is. Now what happens is, our mast cells and certain other cells are going to release certain chemotactic factors like histamines or leukotrienes or platelet derived factors, and these are going to play a role in attracting this leukocyte from the blood vessels. So they will be causing a chemotactic attraction. Okay, so now this migration of leukocyte from the blood vessel to the site of inflammation through the chemotactic factors is called as chemotaxis. So certain times it will come as a 3-marker question. So there is a way of answering. You have to explain what is a chemotaxis. You might draw a beautiful diagram like this explaining, and you have to also tell about chemotactic factors. Right? Next, what happens is, there will be a step of phagocytosis. Now, what is a phagocytosis? So, basically, it is a process of engulfment of any solid particle or material by the cell. So, the cell majorly that we are talking here is macrophage. Okay, and this phagocytosis has 4 steps. There will be recognition and attachment, then the engulfment, then secretion of lysozyme, and then the digestion and degradation of that particular cell or bacteria or virus or anything, right? So through this process, through phagocytosis, they're actually going to kill or fight the bacteria, right? Now, what is the fate of acute inflammation? So majority of the times it is going to resolve, right? And it may heal by scarring. It may also progress to separation, and some of the times it may also progress to chronic inflammations. So chronic inflammations can be cancer or maybe TB, right? So now when we talk about inflammation, we should know exactly what is the difference between transudate and exudate. See, transudate is basically the disturbance of hydrostatic forces. It occurs in disturbance in any hydrostatic forces, but exudate is majorly involved only in the cases of inflammation. Right. Now, it will contain normal fluids. But in exudate, they will have plasma protein and leukocytes. So when we talk about protein contents of transudate and exudate, so we know that plasma protein or protein is present majorly in exudate, right? That's why the appearance also differs. Here it is clear and here it is cloudy. And specific gravity, it less than 1.01 and it is more than 1.02. So that was it about acute inflammation. If you guys liked the video, please like, subscribe and share it with your friends.